anesthesia and the anatomy. So let's see what are the different types of anesthesias. The anesthesias are broadly categorized into three different areas. As you can see from this figure, the anesthesia, local anesthesia is the first category, regional anesthesia, which has several other categories, and general anesthesia. These are the three broad definitions or different types of anesthesias. Now let's see one by one. Now, local anesthesia, this can be of another two types. It could be a topical anesthesia where you give something directly on the skin. So there could be a lidocaine cream, a lidocaine jelly, which is applied directly on the skin so that it penetrates and infiltrates the area of the topical place where you have put in the patch, and that will get anesthetized. The infiltration meaning you take the anesthesia into a syringe pump, and not syringe pump, a syringe, and then you infiltrate directly into the skin rather than topical, which is placed on the skin. This is directly injected into the skin. That's the difference between local anesthesia, topical, and infiltration. The second category is the regional anesthesia. Now, regional anesthesias, as the term says, regional, as the term said, local, meaning you are doing something locally in that fixed area. Regional means in that fixed region. And general anesthesia means in general, the entire body is used. Entire body is used for this process, meaning the entire body is knocked off for the general anesthesia. In regional anesthesia, the difference between local and regional anesthesia is local is very limited. For example, it could be not more than 10 centimeter at a time. So you directly placed or infiltrate the area with local anesthetic, which will infiltrate the area, say 10 centimeter wider or in diameter, while the regional anesthesia is smaller than general anesthesia but bigger than local anesthesia. So if this is, for instance, if this is 10 centimeter, this would be say 100 centimeter, and this would be the entire body. So that's how the differences are. General anesthesia is the whole body, regional is the region in a body, say for example just the hand, just the leg, just the upper body, just the lower body. That's a regional anesthesia. And local anesthesia is very limited to one simple localized smaller area. So that's a broader definition. In regional anesthesia, we have further subdivided into five different sections. These sections starts with peripheral nerve block, ganglion or plexus block, epidural, spinal, intravenous. So again, peripheral nerve block and ganglion nerve block. So peripheral block and ganglion block, then epidural, spinal, and intravenous. Now let's see, to understand this, you need to understand the terminology. So go back to the medical terminology section, see if you need to understand anything, or simply Google the terms and understand the definition, or at least the part which is most important. Peripheral nerve block. Peripheral meaning something which is away from the center. So central and peripheral, these are two basic medical terms. Now, centrally is something which is placed in the center of the body. Peripheral means something which is at the end of the body. For example, the fingertips. Fingertips are the peripheral area of the body. On the other hand, if you see chest or thorax is the central in body. So peripheral nerve blocks are used for a peripheries, meaning hands, feet, toes, the fingertips, all those regions. That's a peripheral nerve block. So one particular nerve is isolated and it is blocked by using anesthetic agent. That's a peripheral nerve block. Ganglion or plexus block. So anatomy, if you know the brachial plexus and the different ganglions in the body, then you would understand what exactly is ganglion or plexus block. I'll give you an example. The brachial plexus. It's a famous nerve root region in the shoulder joint. So in case if the person has subluxated or dislocated elbow, the ganglion or plexus block can be used. So what do they do is basically underarm, they reach to the area of the underarms, which is the armpits area, and you infiltrate a local anesthetic. It's not a local anesthetic, anesthetic agent in that shoulder joint inside the arm area so that it blocks the peripheral brachial plexus. So the brachial plexus, once it is completely blocked, meaning the area of the shoulder, below shoulder, will be completely blocked, meaning you can do all procedures. If you need to do some casting for recasting region, if you have a malunion of a bone, if you have dislocation of elbow, all those can be done with the ganglion or plexus block. That's your second category of regional anesthesia. The third category is epidural. Now, epidural and spinal, these are the two important areas. This we will cover in much more detail in the further lecture series. But just to give you definition differences, epidural is something which is outside the dura mater. Now, dura mater, gray matter and dura matter, there are two different matters in the central nervous system. It starts with the brain, it goes up to the spinal cord. So these two, epidural and spinal, these are a kind of a different types of spinal anesthesias. Now, spinal anesthesia, if you want to block a bigger region, you go for spinal. If you want to block a smaller region compared to the bigger region in the spinal anesthesia, you go for epidural anesthesia. So this is bigger, the spinal, the epidural is smaller. That's how you can remember for now. But actually the difference is the location of the anesthetic agent which is put in the spinal cord. So the location, the area where you put in the anesthetic agent will be the different in both these spinal anesthesias. The last region is the intravenous regional. So sometimes the anesthetic agent needs to be put into the intravenous area. So that intravenous means inside the vein. So as you already know, there are three major vessels in the body: the arteries, veins, and nerves. Artery, vein, nerve. That is singular. Arteries, veins, and nerves, plural. So in the veins, you put the anesthetic agent and you block a particular region. That is the last type of regional anesthesia, the fifth type. So those are all five different types of regional anesthesias. Moving on to the general anesthesia, again a very important area. The general anesthesia is broadly classified into three different varieties. The first one is total inhalational anesthesia. The second is balanced anesthesia, and then total intravenous anesthesia. Now, the difference between, say, TIVA, which is total intravenous anesthesia, and total inhalational anesthesia is the definition. Just see the wordings. Total intravenous, total inhalational. What is intravenous and what is inhalational? You know the definition, you will know the answer. Okay, so inhalational means something which a person inhales or takes from the lungs. So this is basically a gaseous exchange. This is a gas which is given to the patient, which knocks off the patient entirely, because this is a general anesthesia. This is the intravenous. You use the anesthetic agent and put it into the intravenous line, and you anesthetize the patient completely. These are the two different types of general anesthesia. And the balanced anesthesia. So balanced anesthesia is midway between these two. You use some inhalational agents, you use some intravenous agents, and you come to a balanced area where you get the complete knocking off of the patient, but with the usage of both the technique, inhalational and intravenous. That is your balanced anesthesia. So in inhalational, which is a gas exchange, the anesthetic agent which is usually used is ether. So that's an ether based inhalational anesthesia. Intravenous is basically analog sedation. So analog means so this has a combination of several drugs. So depending on the patient's history, patient's medical history, clinical history, past history of any allergic reaction to different anesthetic agent, anything and everything related to anesthesia in the patient's past history, sensitivity, and the patient's current clinical condition will give you a combination or a cocktail through which you will use all maybe one drug or maybe more than one drug to give intravenous anesthesia to the patient. So, this is in general total intravenous anesthesia. So, again, quickly recapping the different types of anesthesias. The first one is local, then regional, and general. Local is divided into topical and infiltration. Regional is divided into peripheral nerve block, ganglion or plexus block, epidural, spinal, intravenous. And general anesthesia is divided into three types: total inhalational anesthesia, balanced anesthesia, total intravenous anesthesia. Total inhalational has ether as an anesthetic agent, and total intravenous has cocktail or analog of different sedating agents used to give general anesthesia. So that's pretty much for this session. Thank you. Please do write me a review and a feedback if you like this. Tell me also what else would you like to get introduced to, and I will make a video for that as well. Thank you. Do write me a feedback.